A community health worker is a member of the community who is recruited by the community itself to learn and be taught about maternal and child health and nutrition, or HIV and AIDS and water and sanitation, so that they can take that information back to their neighbors, their families, the community at large, because there's no other learning resource in those communities. They're the people who bridge knowledge and capability with the communities where they live. When a community health worker program is well implemented, well supported, integrated well into the community and supported by the government, it can have really profound effects on decreasing under 5 child mortality and maternal mortality, and decreasing disease and illness in general. World Vision's timed and targeted counseling approach with community health workers, which we've implemented in over 20 countries globally, has had these effects. In Ethiopia, for example, our program, which was also funded by the Gates Foundation, had results of dramatically increasing exclusive breastfeeding and increasing dietary diversity in the families with which we worked. In 2007, I traveled to India to review and evaluate our community health worker programming there that we refer to as timed and targeted counseling. And I got to go to a particular community where we'd been implementing that work through community health workers. And with one of the families that we visited, we met with a mother and her small child who previously, before our intervention, had really been suffering. And this child, the same child that I met with, was malnourished and suffering from a number of diseases there. But then, after having been assisted by the community health workers in our timed and targeted counseling approach, the mother was just beaming and smiling and showing off this small child now who was kind of plump and robust and laughing. It was a complete transformation in their family and in that child's life because of this work. World Vision is already working with over 70,000 community health workers who are addressing maternal child health and nutrition objectives, HIV and AIDS, water and sanitation objectives, and our goal is to work with over 100,000 community health workers in the coming years. I think that as a supporter of community health worker programs globally, World Vision is the best and strongest agency in this work.